Surgeons of Reddit. What was the biggest mistake you've made while operating on a patient? Not a surgeon, but I am a histotech. We work in the pathology lab where all the specimens are sent. A surgeon did a double mastectomy based off of a different hospital system's pathology report. Basically, the report said she had the kind of breast cancer where both breasts needed to be removed. But we had found zero cancer in either breast. He was crapping bricks, so we submitted both breasts in their entirety. That's a ton of blocks, and it's unheard of to submit all the tissue like this, but he needed to find cancer. I've never seen a surgeon stand there and watch the pathologist like this guy did. We all felt so bad for him and, of course, the patient. He was so upset, cussing up a storm the whole time and screaming about why he never takes outside pathology reports. Turns out the other lab had mislabeled her specimen, so some other lady got the all clear who had cancer and she lost both breasts when she didn't. All around horrible situation, and the surgeon was sick over it all. Yeah, this would be one of the most upsetting moments of my life, for sure. Surgeon was just doing his job, doing what he was told, and yet he will feel responsible for the rest of his life for this. And it really isn't his fault, but it's never going to feel that way. Story 2. Malpractice stories can be tough. I'll lighten the mood a bit. Was doing varicose veins surgery on a very posh middle-aged lady. Very cut-class accent. There was an anesthetic that we used that sometimes induced some hallucinations, either going under or coming out of anesthesia. Anyway, this lady was in recovery just coming out of the anesthetic. The team were around her waiting for her to wake up and gag a little on the tube in her throat for breathing. So we knew it was time to remove it. She gagged, we removed the tube, and she smacked her lips and said loudly in her incredible accent, "That's the best bit of dong I've had in years." The whole recovery room just fell about laughing. Luckily, she didn't remember it. Honestly, wish this story was a little further on because I have a feeling this is gonna get a bit rough. But thank you, OP, for lightening the mood. Story 3. Not the surgeon, and I'm sure not even sort of his biggest mistake, but this was one of the more bizarre things I've witnessed in an OR. Surgeon brought a bad pair of glasses. So here we are, total hip replacement. Surgeon is going to town with what I lovingly call the human grater, which is a doohickey to make sure the new hip socket will fit in. Picture a cheese grater wrapped around a golf ball on the end of a power drill. It's, not pleasant. Anyway, dude's grinding away at the feller's hip and suddenly yelps in surprise and stops, backing quickly away from the table. We're all like, what the hell? His glasses spontaneously broke in half. They were the types that didn't have rims, just lenses with a bar across the nose and bars for the ears. So the metal crossing the nose snapped at the screw. Surgeon quickly starts stripping off his gown, etc. Had the full face shield get up. Ortho ORs are, splashy. And he leaves the room. Comes back with a roll of tape. Him and the circulating nurse can't get them fixed, so he just holds them to his face and has her run the tape around his head a few times, then suits up again and goes back to acting like nothing happened. All in all, added like 10 minutes to surgery time, at least that I could catch directly. Hadn't been with that surgeon before, but I can't imagine that was his best performance afterwards, seeing as how his glasses were taped across his eyes at weird angles. But yeah, don't buy $5 readers for the OR. Story 4. Not a surgeon, but I had a screw put in to hold together a fracture in my wrist. At the last moment before surgery, the anesthetist told me I could have the surgery with a local rather than a general anesthetic as planned, so I let her make the call for me to be awake. During the drilling, my surgeon started complaining at length of why he hates the drill he's using and how it's inferior to the other type of brand. It was apparently the only one he could find at the time and he didn't want to reschedule. Once the screw is in, the surgeon says to close up. Someone asked if the screw should protrude as much as it was, to which he responded, "Nah, but we can get away with it." And you never want to take a screw out and put another in as you essentially wear the thread of the bone. Then silence for about 10 seconds while I feel them shifting wrist around, followed by, "Actually, we better put a smaller screw in." When I was in recovery, the surgeon was surprised how quickly I woke up and had a slight look of surprise when I told him I was only under local. Next thing he said was, "Surgery went well." Story 5. Veterinarian here. We do quite a few surgeries, so I hope this counts as a real response. Mistakes likely happen all the time, from nicked blood vessels to skin/organ tears. Most are probably fairly minor. In the veterinarian world, I've certainly heard stories of male animals having an abdominal incision during a neuter since someone thought it was a female for a spay. Wrong limbs can be amputated. Surgical instruments and sponges/gauze can be forgotten in patients. There are many pre- and intra-surgical checklists to prevent these, and I'm sure it's even more developed in human medicine. Fortunately for me, the biggest surgical mistake is probably a suture slipping when removing an organ, resulting in a minor internal bleed. Fairly easy to find the bleeder and get things stopped up rather quickly. or having a small bone break when repairing another fracture. Things happen. We address it and learn from it for all future patients. Story 6. My mother's surgeon says, well, not doing basic math correctly and sewing up a woman having spine surgery with 2 sponges still inside of her. My mom was 20 plus years sober, so she refused most of the pain meds. When they had to confess they screwed up, she had a mental breakdown facing all that pain again. She got a lawyer and they settled ASAP about $50,000. Mom thought that was fair, but my godfather is a retired federal prosecutor and said it would have been an easy $100,000 with another attorney. Story 7. Not a surgeon, but I can tell you of one. My mother-in-law had a bad fall while on vacation in Florida and had to have hip surgery. During it, they nicked her bowels without realizing it, until almost 2 days later when she started complaining of abdomen pain and her blood pressure started dropping. By then, she was already septic and went into a coma, but they couldn't save her. The hospital declared her death natural causes. We only know otherwise because my husband's family hired someone to do an autopsy before they cremated her body. Story 8. I'm not a surgeon but an OR nurse. We were doing an APR for a patient with rectal cancer. Quick summary. You remove the rectum/anus, close the anus, and the patient has a colostomy for the rest of their life. This procedure was done robotically. The rectum was removed/detached and wasn't immediately removed, not uncommon. I went to lunch and when I came back I noticed the lack of specimens on my table. The patient was already closed and minutes away from being extubated. The surgeon had to return to the OR, reopen the patient and remove the specimen. Big deal! But luckily no real harm to the patient. Story 9. A long time ago I worked for a law office as an administrative assistant. The office represented doctors who were going in front of a medical board to defend their licenses when they were accused of violating medical conduct. There were surgeons who routinely left items in their patients over and over again, who kept getting let off. A doc who was forging paperwork for patients to show that they provided services to their kids when they were never provided, which caused an outbreak of disease and resulted in innocent people dying. There were doctors who were using their medical knowledge to poison family members. I obviously can't go into any details, but that was terrifying. Most of them kept their licenses and faced no recourse. Oh, besides losing a little money in a malpractice suit and getting their malpractice insurance raised and occasionally paying a fine to keep their license. There are a lot of good doctors out there, and these were not them. Scary outcomes. Well, that is certainly unsettling, to say the least. I always kind of hoped that they would be, harder on doctors in situations like those. Guess not. Story 10. 13 years in practice as a surgeon. Thus far, myself haven't had any major operative F-ups. However, everyone who's a surgeon gets their training at some kind of academic medical center. The mentors at these places tend to be one of 2 varieties. Type 1, the highly competent role models. And Type 2, surgeons just barely competent enough to stay in practice, but with their mistakes frequently reviewed publicly for educational purposes by the trainees who also work at the same facility, so they can call those of Type 1 for rescue help during the operation. By far the most common mistake made by Type 2 surgeons is doing operations on patients that were beyond hope of recovery. This frequently results in suffering for everyone involved, and many times a more expeditious death for the patient with a terminal illness. A good example would be attempting to resect large, unresectable metastatic cancers wrapped around sensitive vital structures. Some Type 2 surgeons make careless mistakes, like how I watched a vascular surgeon that forgot to reverse the vein graft when doing a bypass. So all the valves were pointed the wrong way and the graft doesn't flow. I also once saw a cancer surgeon use the ultrasonic dissector to accidentally divide the external iliac artery. Have heard about inadvertent vascular injuries to the iliac vein and aorta. All but the last of those were identified and corrected with the patient suffering no adverse consequences. Lots of times bowel injuries are missed, and the patient has to go back to surgery for a resection or repair. That is super common because the bowel is very thin and fragile, and partial thickness tears can break down in unhealthy patients with a lot of previous surgery and lots of adhesions. Even great surgeons get leaks once in a while for all kinds of reasons, but most commonly overconfidence in a really sick patient's ability to heal a technically proficient surgery. Sometimes timing an operation or part thereof is the most critical thing. Having good enough blood pressure, heart rate, oxygenation, and nutrients are just, if not more important, for some types of surgery where functional organs are reconstructed rather than just being removed. There are some common sayings among surgeons, and one of these is, it takes 5 years to learn how to operate, 10 years to learn when to operate, and a lifetime to learn when not to operate. Story 11. Surgery resident here. For the non-medical people, a doctor who's in the middle of a 5 to 8 year surgery training after med school. This is not my mistake. I was not scrubbed in this case, but a mistake of a mentor of mine who I considered one of the best surgeons in terms of surgical technique, as well as warm bedside manner and just as a teacher. A healthy young patient with acute appendicitis, booked for a laparoscopic appendectomy. This is a minimal invasive operation, commonly performed every day for removing the appendix through 3 small 1 to 2 centimeter incisions, followed by placing special ports through incisions to allow laparoscopic instruments to go in your belly. Before placing the ports, we inflate your belly with CO2 like a balloon to make space for the trocar ports. Each of these trocars/special ports have a pointy javelin-looking thing so it can enter the abdomen. The first one goes around your belly button. The second goes somewhere below the belly button a few centimeters. The third one goes somewhere on your left side of the belly. In my mentor's case, the first port went in smooth, but upon placement of the second port, the trocar, a javelin-looking thing, part of the special port, went through the crotch of the common iliac artery, and also into the left iliac vein underneath it. Vascular surgery was called in emergently, and the abdomen was opened up the old-fashioned way via laparotomy, vertical incision middle of the belly, and vascular team tried to repair the injury. The patient coded from massive blood loss and eventually died after many hours of CPR, resuscitation, and transfusion. The loss affected everyone in my surgery department, not just my mentor. It was absolutely devastating. As someone who is known, someone who went to go get a laparoscopic appendectomy, I am very glad I didn't read this story before that happened. I would have been incredibly worried. But I can't imagine how devastating it would be to have something so bad occur on such a routine, normal, everyday surgery. Story 12. Not a surgeon, but a few years ago, my mom had a major stroke, which left her on a permanent feeding tube, placed in her abdomen, for about 3 months of her recovery. I will say she got the absolute best care other than this incident, and she had a miraculous recovery, to quote the doctors. When she had the feeding tube removed from her abdomen, we weren't worried, because it's a fairly simple procedure from what we were told. Then my dad goes to change the bandage when the time comes, and what else does he find but a string sticking out of my mother's incision? So he called the doctors thinking, that probably wasn't right, and they very quickly got her back in to remove the pieces they left in her. My dad taped the string to a sticky note and hung it in the kitchen. He said he would file a lawsuit, but nothing yet. I think he's just glad she's alive and tired from all we'd been through. Story 13. Not surgery, but EM. Perhaps it's less shocking because we have a more chaotic environment, but I have a lot of stories. Many years ago, trying to straighten out some fractured forearm bones, I managed to dislocate the wrist. The patient was very likely headed to surgery anyway, but I tried so hard that I made it worse. I've given activated charcoal to an overdose patient that then progressed to needing intubation, which is much more difficult to do when everything in the back of the throat is pitch black. Sometimes one injects too much local anesthetic and it distorts the tissues, making it more difficult to close a laceration in the best cosmetic way. It's a fine line listening to the patients that always want more painkillers but also want a pretty result. I once saw a kid with a runny nose the night before his parents had tickets to fly to Disney. Silly me, I examined his ears. Although no ear symptoms, he had a bright blue piece of plastic in his ear. Therefore, I felt obligated to get it out. Kid is not cooperative. Sedation. Lack of success. Multiple doctors tried. In this situation, we usually discharge to go to ENT clinic tomorrow, but they had morning plane tickets. I don't recall if they rescheduled their plane tickets or went to Disney with asymptomatic ear plastic, but after hours and hours fruitlessly messing around with me, I feel I probably ruined their Disney trip either way. What do you mean ruin their Disney trip? The kid had a piece of plastic in his ear. What are you supposed to do? Doctors are not trained to be like, well, that's probably not going to cause any problems. Go Disney. They're like, hey, this could be a problem. We should deal with it now. Who cares if their Disney trip was ruined? Story 14. Med student. So I was just there to observe. Elderly lady with dementia in for an above-knee amputation. After cutting through her tissue to expose her femur, the surgeon started with the bone saw, and within a few seconds started cursing, and everyone around him seemed perplexed. Turns out the patient had a rod in her femur that the surgeon didn't know about. A few other surgeons came rushing in a few minutes later, and they all figured it out eventually, with a mallet and lots of pounding. I had a lot of questions, but was not in the right place to ask with all the tension in there. I guess it was a learning experience. Story 15. When I was in school, I had an instructor who took a job as VP of patient care at a big American hospital. She said there was a patient who had been on the unit for a year and the hospital was footing the bill. When they told her why, it was just about the worst thing I've ever heard. He was in for a brain surgery, and they had removed a large section of his skull to access the brain. Then, They dropped it on the floor. They tried to clean it up, and they apparently gave him a lot of post-op antibiotics. But he inevitably developed encephalitis or meningitis, or, well, probably infection of the whole head. Not necessarily the surgeon who dropped it, though. I can't even imagine what it would feel like to drop part of someone's skull on the floor. What an absolutely horrifying moment that must have been. The poor patient, too. You never expect that to be the thing to go wrong during brain surgery. Story 16. Not a surgeon, but my mom had to get a mastectomy on her left breast. They were getting her ready and came in saying, "Okay, so we're gonna remove the right one." And we're like, no, the left. The nurse goes, hold on. And cue 15 minutes of endless right, both, left, and several different nurses coming through. Finally, the surgeon comes and is like, left. The same surgeon told her the tubes they put in for drainage would be removed by the time she could go to work in a month. A resident came one day after the surgery toward the end of the day, told her he was there to take the tubes out. She said, "No, the surgeon said it would be a month." He pressured her and took them out. These were stitched to hold them in place. The next day, she's in so much pain and her chest is swollen and hard. They call the surgeon and he comes in without the resident that's been following him around. He's like, "What happened?" He is upset. He drains her and is like, "We have to get the fluid out," and says to try it one way since they can't go back and insert the tubes. Christmas Day. He's in his office draining my mom's wound, but he is telling her what else to try to help the drainage. He had his resident apologize and laid into him. Then said next time if there's a question, everything stops till you hear from the doctor in charge. I also had a minor one. I was having a root canal and sudden pain. Apparently, I had 5 roots instead of the standard 4. It was visible on one x-ray as a thickened root, and another angle you could just barely see the 5 merged in a 4. Nothing major, more pain-numbing and extra time, but he kind of shook his head and said, "Oh, weird." Not the first time a medical professional has said that to me. Weird is definitely up there on things you don't really want to hear your doctor say. Weird, never seen that before, that's a new one. All a little concerning. This first one, though, I would be insanely upset at that doctor or resident. Why in the world would you not ask the person who's supposed to be teaching you if there is any sort of discrepancy? Maybe they were just thinking they wanted to prove themselves in some way, but that's not worth the risk of someone's health, man. OP, what a horrible experience for your mother. I'm so sorry about that. I hope that resident either learned fast or is not a doctor. Anyway, it is worth noting that accidents happen, in any profession really. It just happens to be a little more noticeable when it's from a doctor. That being said, I hope you found these stories interesting. I also hope you have a wonderful day or night wherever you are, and I'll see you in the next one.